are there any side effects of TRT that we can just expect when we start out?
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
I wouldn't say that there are any side effects that are going to happen. Absolutely. I would say that there are side effects that you can watch out for. You know, our hope is obviously that people do not have any type of negative side effects. And, you know, so that's one of the reasons that we work closely with all of our clients to try to ensure that they don't have any negative side effects. We run follow-up labs. You know, I'm sure most clinics run follow-up labs, usually probably 7 to 8 weeks out. Some of the side effects can obviously be acne, as you know. There could be some aggression. That's very well. We've never had that happen, by the way. We work with a lot of guys, and we always are telling people that, hey, if you feel a little bit more agitated than normal or any type of aggression, you know, just please let us know. And no one has reported back with any of those symptoms. You know, I would say probably the biggest one might be site injection issues. You know, every once in a while, someone will inject. We do a lot of injecting. Some guys have cream or used cream, as you know. So, you know, sometimes you'll have a little irritation at the site, but we're always hoping for no side effects. And I think for the most part, we avoid them. We also tell hair thinning is a possibility. You know, obviously when you're taking testosterone, you're impacting some downstream hormones as well. And so we're trying to keep those as balanced as we can. And then we're always watching out for any type of, you know, negative side effects related to those. But if we can balance someone, you know, it's great. And then over time, you know, as you've discussed on the channel before, you're trying to sort of dial in to each individual's unique levels and when they feel their best. And you're always making ongoing adjustments to make sure that people feel at their best. I will tell you, we had one guy, so this is a case which is interesting, where a level or a dose can be too high. You know, a lot of guys come to us and they're sometimes less is more. So I have a client who's about the exact same physical size as me. He's about 6'1", 200 pounds. And we were taking about the same dose initially. And when we ran his lab work, it looked good. You know, he's on the high side of normal, but everything else was really balanced. But he felt that his libido was off a little bit. And so in his case, we downward adjusted over time and we dialed him in, and his dose ended up being about half of what mine is. And so he was a rare case, by the way, because most guys, I think, have a much better libido over time. But his was the rare case where his levels were a little bit too high. You know, could have been estrogen was well, I don't think it was estrogen, actually. That was fine. But, you know, maybe it was the testosterone, maybe it was the DHT, and he didn't feel like he was at his best. So we're downward adjusted. And that's the case where we're trying to tell people, don't pay attention to numbers necessarily. Yes, it's a good guideline, but more sometimes is less. And so that was a rare case. But, you know, for the most part, there are none that we go into it thinking we're not going to have any type of symptoms, and we're hoping that we don't have any. And then if we do run into the rare one, we obviously try to address it.